help people with mental illness or substance use disorder or both access resources more easily. Governor Reynolds, you see there, signed that bill into law in Cedar Rapids this morning, saying that getting access to services across the current system has been difficult for patients and providers.
And KCRG TV9's Rebecca Vaughn spoke with a mother today who says she hopes this bill will help people like her own son.
Our son early on, many years ago, they really thought it was a substance use disorder primarily. And so we got treatment for him at a substance use treatment center, which was fine. But it didn't really address, even though it was known as a dual diagnosis program, it didn't address his mental illness beyond giving him the same prescription he already had from a psychiatrist.
Leslie Carpenter with Iowa Mental Health Advocacy said mental illnesses and substance use disorders often go hand in hand, but getting care for both in the same place can be tricky.
If you have somebody that has mental illness and you're getting them into mental illness treatment, but they also have a substance use disorder, often there are some psychiatrists that won't even address the other part.
Wednesday, Governor Kim Reynolds signed the bipartisan mental health reform bill at the new headquarters of the nonprofit Foundation 2 in Cedar Rapids.
We have a new law.
It changes the state's 13 mental health and disability service regions and 19 separate service areas for substance use treatment.
While the mental health regions are funded by the state, they're not aligned with the substance use disorder system. The result is duplicative and inconsistent programs statewide, an inefficient system, and worst of all, poor outcomes.
Those 32 separate regions will become one unified behavioral health system, broken up into 7 districts.
For the first time, we will have an intentionally planned system that includes, in statute, prevention, treatment, and recovery.
Steps are already being taken so the law can be implemented by next year, but Carpenter has some concerns about the transition process.
And it's always nerve-wracking when things get reorganized, and I sure hope we don't lose providers right in the interim, but in the long run, it only makes sense to provide care in a more integrated way.
But overall, she hopes the new law helps people like her son.
My hope is that it will be easier to access care in a setting that is a lot less traumatic than what our son accessed care. We ended up having to take our son to the emergency department of a hospital the first time that he really needed care, and that's a traumatic setting.
In Cedar Rapids, Rebecca Vaughn, KCRG TV9 News.